More than 200 million people in Africa could be infected with the new coronavirus, a new World Health Organization modelling study has found. As many as 150,000 people on the continent could die in a year unless urgent action is taken, though the study's authors predicted a lower infection rate than in other parts of the world. There's concern that countries' health systems won't be able to handle mass infections. Meanwhile, Burundi has expelled a World Health Organization team in the middle of the pandemic, days before presidential elections. The government gave the 4 officials a few days to leave the country without specifying the reason. An official told AFP that the health minister accuses the WHO of unacceptable interference. The announcement came amid low testing for COVID-19 and few precautions against the disease. Burundi has officially recorded 27 cases and 1 death from the coronavirus, but doctors speak of more deaths of patients who had COVID-like symptoms. Authorities have downplayed the seriousness of the virus and allowed public gatherings like mass election rallies, in contradiction with the World Health Organization recommendations. Burundians will choose a new president, parliament and local officials on the 20th of May. The WHO defended its team and said it was trying to find out the reasons for their expulsion. Truck drivers are one of the few groups of workers allowed to travel around East Africa to ferry essential goods across the region. But a high number of COVID-19 cases among the drivers has raised alarm that they may spread the virus along the way. Kenya has begun mass testing on its border with Uganda to spot infected truckers.
It is good to test us truck drivers because we mix with a lot of people and meet various types of people along the way.
Then I can comfortably say that we are able to test approximately 5,000 samples within a day, right here in KEMRI.
A Ugandan wildlife sanctuary is appealing for funds as it only has enough money to feed its animals until June.
We have had a shortfall of $400,000 as a result of the lockdown, which was basically supposed to come from the visitors. And since we closed down, that implied that that income is not coming in.
No visitors have been to the Ugandan Wildlife Conservation Education Centre since it closed its doors in March. But the animals themselves have been thriving in the quiet, finding it much easier to breed. Meanwhile, Kenya cordoned off a suburb in the capital Nairobi, along with Mombasa's Old Town, to stem skyrocketing coronavirus figures. Both locations have recorded more than 60 cases each, out of a total of 582 nationwide. Similarly, as Angola tentatively reopens, one neighbourhood in Luanda remains isolated after several residents were diagnosed with COVID-19. To date, Angola has recorded just 43 virus cases, including 2 deaths. Young people have been part of innovation to tackle the virus. Engineering students in Senegal have invented automatic hand sanitizer dispensers and medical robots. From their engineering school in Dakar, they've turned their technical skills toward easing pressure on wards, and they're already in talks with hospitals.
We realized that in Senegal, at least in developing countries, medical equipment to protect health workers was limited. Since the workers are on the front line of the fight, the idea is to protect them so that they can protect and lead the fight against the pandemic.
And an innovative 9-year-old boy from Western Kenya has designed a machine that allows people to wash their hands using a foot pedal, helping to avoid the spread of germs. Steve Wamukota has become a social media celebrity following his invention.
On the first day I collected timber, nuts and nails, and on the second day I started making this machine. I continued on the third day, and on the fourth day my dad helped me finish it.